Inslee.
Gentleman's recognized for 1 minute.
Thank you, Mr. Speaker. I just want to relate one call from a small businessman told we needed health care reform so that his wife could finally start a small business of her own and be freed from the insurance industry that stopped her from getting insurance. I'd like to enter into a colloquy with Mr. Waxman. Mr. Chairman, I would like to clarify an issue regarding Section 1188, the generic fill provision in the bill. This section allows Medicare Part D plans to waive patients' copays for generic, bioequivalent, and biosimilar drugs. I believe that absent explicit approval from the patient's doctor, this inducement should only apply to those biosimilars that have been rated interchangeable by the FDA, meaning that they can be expected to produce the same clinical result in any given patient, and switching medicines poses no greater risk than not switching. With respect to biosimilars that have not been rated as interchangeable, is it your intent that under this provision patients could not be switched to a non-interchangeable biosimilar drug without an explicit request by a patient and approval by their doctor?
Congressman Inslee, you are correct. It's our intent that the patient would not be switched from a reference product to a non-interchangeable biosimilar without approval from the doctor. I yield myself another 30 seconds. Our intent is also that a patient could not be financially induced by their plan to switch to a non-interchangeable biosimilar without the consent of their doctor, and I'm happy to work with the gentleman to clarify the language.
And today we should pass this bill. Thank you, Mr. Chairman.